Good morning, my name is Dr. Petrikovsky, and the views expressed in this video does not necessarily agree with the views of the institution I'm affiliated with. So I take the sole responsibility for the content of this and other videos. What I would like to talk about now is so-called collateral damage of COVID-19. And as I said, most of the videos are based on peer review publications or CDC recommendations, which are the most reliable information we can get amid the storm of information from various sources, including TV doctors that never saw a patient for the last number of years, because the income from TV performance far outweighs the income from actually seeing the patients. And this is the latest CDC publication regarding the collateral damage of COVID-19. And I would like to show with you the curves, if you can see, the decline in hospital admissions, and it's actually right here with the beginning of the pandemic, for reasons other than COVID, including cancer, including heart attacks, including strokes. The reason is twofold. First of all, that people are afraid to go to the hospital, fearful to catch an infection. As a result, they ignore other medical conditions. And as a matter of fact, at time of stress, I would expect an increase in the incidence of heart attacks, strokes, and other conditions or diseases that obviously have some predisposition, but very often enforced by stress. And clearly, isolation and COVID is a very stressful factor. So clearly, for example, Sloan Kettering Cancer Center was pretty much closed for new patients for a prolonged period of time. Many patients requiring chemotherapy suffered a lot because they cannot be provided with adequate care. So it's very important to remember and not to ignore other medical conditions in spite of the infection. But on the other hand, I just want to share the report that just came out to my attention. It's a case report published in a peer review publication on successful conservative management of appendicitis. That's sort of an interesting good news, because obviously acute appendicitis is usually a surgical emergency. But we knew that sometimes it could be successfully treated with antibiotics. In this particular case, the patient was treated with antibiotics and avoided surgery, most likely due to the COVID-19 infection, because both surgeons and patients are afraid to go to the hospital and to undergo major surgery in an infectious, hostile environment. So clearly, there is always something good coming to bad. Each coin has two sides, and the other side of that coin is pretty much an encouragement to develop non-invasive methods of treating major conditions, including emergencies. Thank you. Don't ignore your medical conditions. Stay alert and safe.